At the Boulder County Jail, incarceration means immediate mental health evaluation.
Keep drinking. Okay.
And it begins here at the booking desk.
And they'll be asked a series of questions dealing with both their medical health and their mental health.
Boulder County Sheriff Joe Pelley, who has been a longtime proponent of providing mental health treatment in jails, says to protect the public, he had no choice but to implement a full-service mental health program.
You have to decide what your philosophy is going to be. And if it's warehousing and security, this problem's never going to get solved.
The Boulder County program is data-driven, and that is in part why the county supports and funds it.
When I became sheriff, 13% of the inmates in our jail had an Axis I mental health diagnosis. They'd been diagnosed with the, bipolar issue or schizophrenia.
Pelley says that 13% from when he was first elected in 2002 has now, on some days, grown to 60% of the jail population receiving mental health services.
We'll see everything from just a unique situational depression all the way up to the most severe, where somebody is actively psychotic or has suicidal attempts.
Melanie Drayling, a registered nurse and the jail's health service administrator, says the jail has a two-pronged approach to treatment.
So what I supervise is more of your acute care. So that's going to be getting people on medications and working to get them stabilized. The other side of the house is the program side of the house, and that's for people that are going to be with us a while.
A lot of our clients that come in here, this is the first time they'll get treatment. This is the first time they might even get diagnosed.
Commander Tim Oliveira heads jail programs and support services.
Once somebody is stabilized from an acute illness, if you will, mental health-wise, they can progress through the jail. And if they require psychotropic medications, we can prescribe them that. Well, you have one-on-one. They also have psychoeducational groups. They also have therapeutic group opportunities. So they will engage in these group-led sessions by a licensed therapist.
The longer they're with us, the better they thrive. We really see people go from being actively psychotic to being a healthy, normal, stable person when they leave our jail.
A lot of people would say, you're not in the jail business anymore, you're in the mental health business.
Yes, jails are becoming these mental health institutions because people don't have anywhere else to go.
My name is Matthew Williams.
He has been diagnosed with bipolar disorder and PTSD. In the past, he has used illegal drugs to treat his condition, and he has a criminal record and was picked up in Boulder on a felony warrant.
I stole a gun in Oklahoma. I had some PTSD already in my life. I felt like that was the thing to keep me safe, was to get a weapon.
He says it was the death of his son that sent him into a mental health spiral.
I held him. Whenever he was born, they tried to resuscitate him, and they couldn't get him back. That messed me up a lot.
Critics argue that jail should be punitive, not a place to provide full-service mental health care. But for detainees like Williams, who for the first time has received treatment and counseling here, it is life-changing.
I wasn't focusing on anything that I set out to do, and they put me on some medication, and it's really helped out a lot.
And that's to treat your bipolar
disorder and my nightmares, and my trouble sleeping, which kind of all goes together.
He now draws, has taken other classes, and will complete his high school GED.
I had a lot of built-up stuff that I did not know existed. I have never seen nothing like this program, and it was a blessing to be in here.
Since we first talked with him, Williams has moved on to serve his state prison sentence, and he has continued to focus on his mental health. He's told us he's doing well. But just as important and essential in the Boulder model is the PACE, our Partnership for Active Community Engagement program, for those who don't go to prison but are allowed back into the community on probation.
We've put the probation officer, mental health provider, community health, public health provider, and a case manager all under one roof so that they're not just leaving our jail without access to medication or without access to support.
The goal of the program is to coordinate with prosecutors, judges, and the parole system to stop recycling the same people through the criminal justice system without any hope of success.
A couple years ago, I was a mess. I was into drugs. I have a mental illness.
Joe Dankowski has bipolar disorder and suffers from schizophrenia. If you hadn't gone through the Boulder County Jail and gotten these services, where do you think you'd be now?
Dead.
You'd be dead.
I'd be dead.
You really think it's life and death?
Yeah. I really do.
We have a support network that helps people re-engage and then be productive citizens versus get released and have no support network and continue to revolve back in there.
Matt Jekyll is manager of the Boulder County PACE program. It serves more than 100 people annually.
We provide people structure. Our entire team knows who you are. You see them daily. We build relationships. But you also have the probation element that's here around accountability for attendance, participation.
Joe Dankowski says he was out of control. He kept cycling in and out of jail, but not anymore. He says he now understands his illness and his treatment.
I know what I need to do to have a clear mind to get back on track.
Do you still hear the voices?
They're very quiet.
And you know what they are?
Yes,
Do they scare you?
not no more.
It's remarkable. He's the same personality, absolutely, and he's a person who believes in himself.
Jekyll acknowledges the upfront costs are expensive, but he contends treatment for patients like Dankowski versus jail is a bargain for taxpayers.
Costs more to put a person in jail and keep them there per day than it does to utilize our services.
But in-jail mental health treatment and programs like PACE are not possible for cash-strapped small or rural counties. Well, Sheriff Joe Pelley understands that. He says he can document why Boulder could be a statewide model, because Boulder County tracks a target group of former inmates who were continually in and out of jail, but who have now gone through the PACE program.
We've had a savings of about 10,000 jail bed days a year with a group of 50 or 60 people participating in that program. 10,000 jail bed days a year at $163 a day per jail bed.
That's a lot of money.
It's a lot of money. So this stuff can be impactful. It's expensive to implement, yet it's pennies on the dollar compared to incarcerating someone.